Prostate photodynamic therapy is a well-standardized technique published since 2015 in the World Journal of Urology. The procedure is based on three main steps: the introduction of the fibers into the prostate, the injection of the photosensitizer intravenously, and the illumination of the targeted tissue by the laser light. The patient is under general anesthesia with zero movement tolerated, as we work at an accuracy of 0.1 mm. He is in high lithotomy position in an operating room. The patient is in the center in high lithotomy position under general anesthesia. The surgeon is in the front of the patient to have access to the perineum. On the left, the ultrasound scan machine, and on the right, the nurse, the laser physicist, and the laser generator. At the head of the patient, the anesthesiologist and the syringe pump. A complete surgical installation shows the ultrasound probe into the rectum, an urinary catheter inserted into the bladder, the grid close to the perineum, and the laser fibers into the prostate. No incision, no bleeding, only needle punctures. To avoid to damage the so-called noble structures, a 5 mm rule is carefully applied. The needles are placed at 5 mm from the neurovascular bundles, the sphincter, the urethra, and the prostatic capsula in order to avoid any damage of these important functional structures. The intermediate laser allows the plugging of 16 laser fibers, but most of the time less needles are needed to cover completely the area targeted into the prostate. The laser fibers contain a window of illumination at the tip with a minimal distance of 10 mm up to 50 mm to treat even big prostates. The fibers illuminate the prostate at body temperature on an accurate diameter of 10 mm. Every centimeter of fiber introduced into the prostate will generate accurately 1 cubic centimeter of necrosis. The prostate photodynamic therapy is a non-thermal technique that allows to better preserve the surrounding structures. The needles are placed every 5 mm with a slight overlapping of laser light and an optimized efficacy of the treatment. The capsule plays an important role as it reflects like a mirror the light coming from the laser fibers, increasing the effect of the treatment on the tissue. Meanwhile, the mirror effect protects particularly the neurovascular bundles, which are on the other side of the mirror, and therefore preserves the erectile function. Before starting the illumination, the patient and also the team need to wear special goggles to protect their eyes from laser exposition. The patient will need to wear an eye protection goggles or sunglasses for 48 hours after the start of the injection. Once all the fibers are in place, the light is dimmed in the operating room. The photosensitizer is injected during 10 minutes and then the laser light activated for 22 minutes and 15 seconds. On a transversal view, the activation of the laser fiber produces a vaso-occlusive effect that will lead to a complete necrosis of the targeted volume in few hours. Once the illumination stops, the procedure is ended. The fibers and needles are removed at once, as well as the equipment around the patient. The photoprotection phase starts with the patient kept in the dark. The urinary catheter also stays until the following morning. Some measures are necessary in the recovery room. The patient stays protected from the light and should not be exposed to sunlight until the following morning. During the 12 following hours, the patient keeps the goggles and stays in the dimmed room. In some cases, the procedure can be performed as day-case surgery with the patient discharged in the same evening after the sunset and with strict instruction of photoprotection. Eventually, after 6 hours, the patient can watch the TV at 2-meter distance and use a smartphone, tablet, or computer. At day 1, the photoprotection phase continues but is less restrictive. The patient stays indoor at home with sunglasses. At day 2, the patient returns back to a normal activity on every aspect of his life. In conclusion, based on the highest level of evidence, prostate photodynamic therapy is efficient to destroy cancer lesions and preserve healthy tissue. It is easy to perform in a short time and no incision. It allows to maintain the erectile function in more than 80% of the cases without incontinence. And in case of failure, prostate photodynamic therapy does not generate loss of chance for following radical treatment.